Hi, this is Dr. Warren again. You know, we all know that people who are old and frail are more likely to have serious side effects from COVID-19. I think that sometimes makes people think that it's easy to catch COVID-19 from older people. But when you really think about it, let's just say that an older person is at home all the time and never goes out, doesn't go to Costco, doesn't go to Safeway, doesn't go out on outings. That person actually is the lowest risk person of being contagious. If that person's home all the time, does that person need to wear a mask? Not at home, because that person is not out anywhere and is very unlikely to have the COVID to give to anybody else. The concern is that other people will bring the COVID to the home. And that's why caregivers need to be very careful, because the caregiver are the ones who are likely to go out of the house, possibly be exposed to somebody who has COVID unknowingly, and then bring it back. And a fair number of healthcare workers have actually brought COVID into hospital systems and into nursing homes, not knowing that they were carrying the COVID. So the older person who's at home all the time is actually the person who's least likely to be contagious. And it's the person that brings it to the home that is more likely to be contagious. And then there's a different question that comes up is, how important is it for an older person to wear a mask? And I think this has been emphasized over and over again. The main purpose of the mask is to keep it from being spread from a person who might have COVID to other people. So let's just say I had COVID. If I wear a mask, my spit doesn't fall on other people. When older people are out on an outing, they should wear a mask. But I think that you just have to use a certain amount of common sense. If a person has severe dementia and doesn't really understand why they're wearing a mask and is fidgeting with it all the time, that's actually worse than not having a mask. So it's just like a child. If you have a 2 or 3-year-old child who's just fidgeting with the mask all the time, that would be very similar to a person with dementia who is fidgeting with it and is just becoming agitated. That would just not make any sense. And in terms of going out, you know, if you have a yard that's totally isolated, that'd be a great place to go out and get some fresh air for an older person who does need fresh air.